Statistical test. A group of physicians wants to determine the relationship between the metabolic abnormalities and moya disease, a chronic cerebrovascular occlusion disorder. A chronic cerebrovascular occlusion disorder that may lead to ischemic or hemorrhagic stroke. Prior data suggested that serum uric acid and triglyceride may both be associated with vaso-occlusion. The physicians therefore designed a study to investigate whether in individuals newly diagnosed with moya disease, serum uric acid levels are independently related to serum triglyceride levels after adjusting for socio-demographic characteristics, BMI, smoking status, and alcohol consumption. 300 individuals are recruited, and quantitative levels of serum uric acid and triglyceride measured at baseline. Which of the following is the best statistical technique to answer the research question? Is it relative risk? Is it cohort?
I think so too. Let's see.
Okay,
Nope, it's linear regression.
okay,
Let's read.
okay. I'm reading the explanation. Variables are broadly classified as qualitative and quantitative based on their scale of measurements. Qualitative variables: type of treatment, blood type of treatment, blood type represent categories or groups, whereas quantitative variables, temperature, glucose level represents numerical values. The scale of measurement of the dependent outcome and the independent exposures risk factor variables in a study determine the correct statistical test. Regression analysis is used to describe the association between one quantitative dependent variable outcomes and a one dependent variable exposure risk factors, which may be quantitative or qualitative, while adjusting for variables of interest. In this study, the one quantitative dependent variable is serum triglyceride, and independent variable is serum uric acid. One quantitative independent variable. The association between the main independent variable, that is serum uric acid, and the dependent variable, serum triglyceride, is adjusted to account for the effects of other independent variable, referred to as adjustment variable or cov- covariates, covariates, that is socio-demographic characteristics, BMI, smoking status, alcohol consumption. Controlling for these variables reduces potential confounding. Calculation of a regression line of the best fit can then determine whether serum uric acid level has a statistically significant association with serum triglyceride level after adjusting for covariates. In this study, uric acid level is considered the independent variable independently related to triglyceride level. However, an equivalent relationship could have been studied using triglyceride level as the independent variable. In both instances, the statistical technique is linear regression. Okay. So educational objective, a regression analysis is a statistical technique used to describe the effect of one or more than one independent variable exposure or risk factor, which may be quantitative or qualitative, on a quantitative dependent variable, that is outcome. Can you please explain?
Um, I think just remember that regression is two quantitative variables. So
Oh,
two ones that have numbers. So here is level of serum, level of uric acid. So it
see.
will be 2, 3, 4, whatever. And level of tags, it will be 150, whatever. So you're comparing two variables that have numbers.
Okay.
Yeah, I think it's easier to remember like that.
So
And
two
then,
variables with numbers, that is linear
yeah,
regression.
yeah, and you can read C and D. It will make you understand why it's not relative risk.
Okay,
This one.
or odds ratio and the relative risk. Odds ratio and relative risk measure the strength of association between two categorical variables. A categorical risk factor, smoker or non-smoker, and a categorical outcome or disease. A categorical outcome or disease, presence or absence of myocardial infarction. The odds ratio is used for case control study and the relative risk is cohort study.
Does it make sense why it's not relative risk?
Yes.
Up next. Uh, oh, I think I guess that's the explanation.
Okay, explain.
It's one of the videos. It says comparing to find the best statistical test for a test. If you're comparing two continuous variables, so I guess two means, I guess.
Yes.
Um, for example, the means between two groups, I guess. And you are using two groups only, then you use the t-test. If you are using three groups, then you use the ANOVA. So if you're comparing means between two groups, or like you're comparing basically a number between two groups. You get what I'm saying? Like
Yes.
suppose the mean number, yeah, between two groups. If it's only two groups, it's t-test. If it's three or more groups, then it's ANOVA. If you are comparing a categorical thing between two groups, so for example, like what? What is categorical?
Chi,
Like what?
like categorical uh
Like
chi
something
square.
that, yeah, not
Something that has like mm,
something that's not numbers. You know, means it's going to be numbers 2, 3, 4, 5.
yes.
Categorical is like something that's not numbers. If you're comparing if you say, oh, I'm going to compare the level of glucose between two groups, but you're not comparing the level like 1, 2, 3, or whatever, not 1, 2, 3, 4, whatever. You're not comparing 50, 70, whatever. You're comparing high glucose and low glucose. So I'm going to say if the person has high glucose and glucose. I don't want no numbers. Then that would be categorical. It's high and low. It's not numbers. Then you are using, if it's a big group or a medium group, you're using chi-square. If it's a small group, like less than 5 people, using Fisher exact test. So it's the same test, it's just that big groups, chi-square, small groups, less than 5 people, Fisher test. And then it's like, oh, if you want to assess the relationship between variables, so you are not trying to compare the relationship. Sorry, you're not going to compare the groups. You're trying to just assess the relationship. So say, let's say you want to say when variable x goes up, then variable y also goes up. Or when variable x goes down, I notice that variable y goes up or whatever. You just want to see how one moves compared to the other.
Okay.
Then you use point number three. In point number three, you can use two different tests. One of them is this one, the regression model. Uh, yeah, I guess. And the regression model, if it's a continuous outcomes, continuous just mean numbers. Just put it in your head that continuous mean numbers. If it's a continuous outcome or a continuous whatever, a number and number, linear regression. Why I just we just saw if both of the
Yes.
things are numbers, yes, it's a linear regression.
Serum
I
uric
don't know.
acid and the triglyceride level.
Yeah, if
Both are
both
numbers.
variables. Because remember here you are comparing the relationship between two variables. So if both variables are numbers, then you use linear regression. I do not remember what he said about logistic regression. I really don't remember what he said. You can watch the video. I don't remember what he said. But and then correlation. Remember here we're just comparing the variables. Um, Here is where you use the correlation coefficient, which is the R. And remember, the correlation coefficient explains both the strength and the direction. So negative will be what? It will be the strength. Huh? I don't remember. Negative will mean like one is going up and the other one is going
And
down.
going down. Yes.
Yeah, positive will be both of them are going up or both of them are going down. Same direction. I guess it's negative is the direction, whatever. And then one will be they are closely related. Because remember, we are thinking about relationship. Close to one will be they are closely related. Then close to negative one, I think that means they are not closely related. I think I don't remember. I guess. And then key definition R2. So if you make the square the double of that, you square it. You square this one equals proportion of variance in one variable that is predicted by the other. I don't mind about that. I don't think I ever saw the question about it.
Okay.
I don't think. Yeah, I think I explained it, but I don't know what. I think the one just remembers that it just means that they're close together or they're not close together. I don't remember really
Okay. When we are
well.
dealing the question, we can find something.
You, oh, I guess that's the question. Okay, go ahead.
A study is performed to evaluate how blood glucose level vary across age. This is categorical with the following result. What is the appropriate statistical test? And what if the cell size were smaller? Isn't it categorical?
Why?
How blood glucose level vary across the age group? Hmm, they are talking about the level of the blood glucose according to the age group. Hmm,
Okay,
okay, they are categorizing the blood glucose level according to the age group.
okay.
Can we say that it is categorical? But
Um,
the it is sample size is smaller, less than 5, isn't it?
we are answering this question first. So
Okay,
what would be the answer to this question?
what is the appropriate statistical s- uh okay, wait. Blood glucose level vary across the age.
Just for reference, because I think that helped me on this question. this is the number of patients. So it says that age 20 to 55, 45 patients were in this group and 93 patients were in this group. So this is the number of patients. I don't know why he didn't say it, but it helps to know that. Okay.
Okay, number of patients. So it is not category. It is compare. Is it the difference between age group? Is it t-test?
Let's go back. With what are you comparing? What are you comparing two groups, or are you looking for a relationship between variables? What are you trying to do? So is
I'm
it
trying.
one or
I am
two?
trying to make a relationship between the variables like blood glucose and age.
So you're trying to see relationship between so you're trying to see if blood glucose increase, age increase, or if blood glucose decrease, age decrease. Is that what you're trying to find?
Is it? I think that it is not.
You think that it's not okay? What do you think it is?
We
Is
are
it
comparing like the
mhm.
blood glucose on the basis of different age, on different
Oh,
age group of people.
okay? So you think it's either one or two, where we are comparing groups, not relationships. So
Yes,
let's take this
comparing
out.
groups. Yes,
Okay, so now are we comparing
more than.
the?
Sorry,
Are you
there
comparing
there is three group age 2020. So is it ANOVA?
where you are going to think you're trying to find first if it's you are comparing number between the two groups, are you comparing numbers or are you comparing categorical data? That's what you're trying to find.
We are
So you
comparing categorical, and it
you are
is less
comparing.
than 5. It is Fisher extract.
So you think this is fish? You want? They think the
Yes,
answer is Fisher.
yes.
Okay. And what do you think the number B is?
What if the cell size were smaller? If cells, uh, if the cell size is smaller, then it is Fisher. Then, if the cell size, if cell size is smaller, then it is Fisher. So, oh, okay, it is chi-square, categorical. Now I made, after reading the second question, I found the answer actually. What if the cell size were smaller? Then it is Fisher extract. And what is the appropriate statistical? It is chi-square, categorical. I don't know why I mix this up.
Okay. So you found the thing right. You're trying to compare categoricals or non numbers between two groups. What are the not two groups? I guess three groups. I guess three groups, whatever. Either way, it's a lot of groups.
Yes,
One, two, three, whatever. So you are using this number two. Now the size of the sample. For this one, we don't check how the number of group. We check the size of the sample. In this one, you have like 93 plus 45. You have a bunch of patients. In this one, you have like almost 200 patients. In this one, so it's definitely not a small sample.
yes, it
So
is a
that's
large
what it's trying
sample.
to work.
Yes.
And then remember, and then look, what is the thing that we're trying to compare? The sorry, what is the category, the categorical, what that we're trying to compare between the two groups? Can you tell me what is that?
What is the category?
Yeah,
A blood glucose level below 100 and more
yeah,
than 100.
exactly. So you see, it's just low blood glucose, high
And
blood
high
glucose.
blood
It's not
glucose.
numbers. That's why you didn't go with this one, with number one. If they were saying it, if here it was like 75, here it was 100, then it was 150, whatever, then it would have changed to t-test and ANOVA. But it's just a low blood glucose, high blood glucose. There is no numbers. And then number two, you got it because it's saying now, what if you decrease the cell size? You've made the cell size smaller, whatever. You already know that chi-square and Fisher is the same thing. It's just that a Fisher has a small sample size. So you got that one.
Yes.
There you go. And he made to give you an example for the Fisher, he just made the things one smaller, like two, three, four, to tell you that the sample size is small. Okay, good. Okay, this give me this one.
Okay. A study is performed to assess the relationship between average ethanol drinks per day and average number of cigarettes per day. You observe following trend-based statistical test and estimate value. Average ethanol drink, average cigarette smoke. Mm, there is no com comparison between measures like means. There is no means. In here, we are comparing between two category like smoker bar and alcoholics. That's what they are trying to mean.
They didn't talk about smokers or alcoholics in here. They talked about the
But the
average number of drinks.
okay, the number. Hmm, no, is it t-test?
Go back to your table, to your whatever. Are we comparing a number between two groups? Are we comparing a category between two groups? Are we assessing a relationship between two variables? Like one is going down, the other one is going up,
Going
two are
up.
going down. What are we doing?
We are making a relationship between alcohol and the
Okay. Okay, so you cannot be not test, not ANOVA, not times, not I
yes.
square. Yeah. What do you think it is?
So it is linear regression.
Uh, I guess that would be an answer, but if you, I guess that would be an answer. But what if they are telling you they want to
Or
know?
we are trying to correlate
Yes,
with between these two groups. So like make
yes,
an make something correlate. We are trying to correlate with the alcohol and the
yes,
sorry smoking and the ethanol.
yes.
Okay, so it's correlation.
So it is. If you look at the table, how that I'm seeing it, it says if you want to use regression, it shows how variable x causes variable y. So it's like a cause, you know, it's like causing. Like here, it was the question that we saw here. It was like how the triglyceride or whatever, how one causes the other, or if the triglyceride and the uric acid. Or it was like how one of them causes the this disease compared to the other.
My this is
Yeah, compared to the other. But the correlation is just to see if one goes up, does the other one goes up, or the other one goes down. So I think here is correlation in this question. And then he gave you the thing, the graph, so you can also, yeah, he
like
was great.
one thing's going up, another is going down. Average ethanol,
Yeah, so
if going up, then smoker is going down, or
yeah,
ethanol is going
and because
down. Yes,
yeah, and because they are going in opposite direction, it's negative. And because I forget how he was explaining the one and the negative and the zero. You have to watch the video. I forgot how he explained. But I think it means that it's a strong association, that the relationship is strong between the two. That's why it's one. It's close to one. But you can watch the video to know that exactly.
okay.
Okay. Question. Sorry.
Okay, question 3.
Please.
A study is performed to compare systolic blood pressure between patients receiving placebo versus drug X, and you find an average systolic blood pressure of 138 among patients receiving placebo and 132 among patients receiving drug X. Most appropriate statistical test. What if we are comparing mean systolic blood pressure among placebo versus drug X versus ACE inhibitor? So we are comparing systolic blood pressure placebo drug is more than 3. So it is ANOVA.
You tell me, what do you want me to write and where?
Most appropriate statistical state is ANOVA.
Okay. What do you want me to write for B?
What if we are comparing mean the placebo? Wait. No, first one is t-test, then second one is ANOVA.
No worries. Did you understand why?
Yes, I understand why I am doing such stupid mistake.
Okay.
Okay, we are comparing the numbers here between the comparing the systolic blood pressure uh, between the drug and the placebo. That means two between two means like the drug and the placebo among 138 patients. So as it as we are comparing between two means, so it is t-test, and then we are telling that we were comparing mean of systolic blood pressure among placebo, drug X, and ACE inhibitor. So it is more than 3. That is ANOVA, analysis of variance. Am I
Okay.
right?
Yes, you are right. Okay. Next.
Okay. Now, clinical trials. A large number, a large number a large multicenter study was conducted to determine the efficacy of pegfilgrastim, a new drug developed to reduce the risk of febrile neutropenia in patients with early stage breast cancer. 1000 women 1000 women are 40 to 69 with stage 1 to 3 invasive breast carcinoma who were scheduled to receive cyclophosphamide based chemotherapy were enrolled in the study and randomly assigned to receive either placebo 500 women or pegfilgrastim 500 women at a dose previously shown in a small trial to have biological study. Results showed that the incidence of results showed that the incidence of febrile neutropenia was significantly lower in the pegfilgrastim group than in the placebo group. That the that patients in the pegfilgrastim group required fewer hospitalization and lower antibiotic uses related to febrile neutropenia. Most adverse events were consistent with those expected for breast cancer subjects receiving cyclophosphamide-based chemotherapy. Researchers concluded that pegfilgrastim is safe and significantly reduce the incidence of febrile neutropenia in breast cancer patients. Which of the following is the which of the following best describes this type of study? Only 500, isn't it?
Mm.
1000. Uh, is it phase 3 clinical trial?
You tell me.
Yes, I think so.
Okay, let's see. It's phase 3. Can you read that, or is it too small? You
I
should be
can
able to
read it
read.
from my first aid. It is taken from
Okay.
the first aid.
Oh, okay. Okay. Read it.
Okay, I am reading from the actual first aid.
Okay.
Wait, where is clinical trial? I don't know where they moved this clinical trial. Okay, wait 1 second. Okay, I am reading from here. It is in the first aid. I have read it previously. Okay, phase 1, small number of healthy volunteers. Is it safe? Phase 1, is it safe? Assess safety, toxicity, and pharmacokinetics. Phase 2, small numbers of a small number of patients with disease of intent, sorry, with disease of interest. Does it work? Assess treatment efficacy, optimal dosing, and adverse effect. Phase 3, a large number of patients randomly assigned either to treatment under investigations or to the best available treatment or placebo. Is it as good or better? Compare the new treatment to the current standard of care. And phase 4, post-marketing surveillance trial of the patients after approval. Can it stay? Detects the rare or long-term adverse effect, can result in drug being withdrawn from the market. Okay,
Perfect. Next question.
okay. A study is conducted to determine whether administration of recombinant human granulocyte colony stimulating factor in the first trimester improves pregnancy outcomes among women with a history of unexplained recurrent pregnancy loss. 150 women with a history of unexplained recurrent pregnancy loss are randomly assigned to receive either RHGCSF or placebo. Daily subcutaneous injection of uh, recombinant human granulocyte colony stimulating factor 130 mcg or identical appearing placebo are administered as early as 3 to 5 weeks of gestation for a maximum of 9 weeks. The primary outcome is clinical pregnancy at 20 weeks of gestation as demonstrated by ultrasound scan. Which of the following is the most appropriate statistical measurement to determine whether RHG recombinant human granulocyte colony stimulating hormone influences the primary outcome? in this study? Okay, what's the answer? Are we talking about hazard ratio?
You think that's the answer?
Yes.
Okay, let's see. Oh, I think it's relative risk.
Okay, you are thinking about relative risk.
No, I was thinking about either hazard or median survival. But let's see, why is it not? Okay, read the answer.
Okay, and this study design is recombinant. Sorry, this study design is randomized control trial in which participants are initially randomly assigned to receive either a treatment, recombinant human granulocyte colony stimulating factor, or a placebo according to the independent variable treatment exposure. One participants are randomized into groups. The occurrence incidence rate or once the participants are randomized into group, the occurrence incidence rate of the independent variable clinical pregnancy within specific period is determined in each group. Finally, the rate of outcome is compared between the treatment group and the placebo group to estimate the association between the treatment and the outcome. The common measure of association of RCT randomized control trial is relative risk, calculated as follows. Relative risk, the rate of the outcome in treatment group divided by rate of the outcome in the placebo group. The RR relative risk may compare the rate risk of outcome between two different treatment groups, one of which serves as control group, or between a treatment group and a placebo group. The rationale for studying recombinant human granulocyte colony stimulating factor in recurrent pregnancy loss is that it may modulate the immune system response to the fetus.
It makes sense.
No.
Right? Remember our chart from biostats one?
Yes.
You, and if you remember it, you see this is RCT, and what
Yeah.
was our measurement of associated relative risk?
Okay.
Remember, it was the same as, I guess it's the same as cohort. That's kind of just what they're trying to say. I think we were thinking as a ratio or median survival because we saw the whole. I don't know. What were you thinking about it?
We are thinking about something hazardous will gonna happen.
Yeah, I think that's what I thought too. I thought they were comparing if the baby gonna die or not.
Yes,
But
recurrent
they,
pregnancy loss. There is a history of recurrent pregnancy loss.
yeah, but here they specify the primary outcome is clinical pregnancy at 20 weeks gestation. So basically, how the pregnancy is going at 20 weeks gestation. They didn't talk about any dying or anything like that. That's why it's not hazard or median survival. And then we also know that the relative risk is for RCT. This is RR. I guess you just remember RR. RCT relative risk.
So how this randomly selected, like which word is
Oh, sorry.
in this question, like in the question,
Uh-huh.
like what made you think that it is randomly selected? Like we know that for randomized control trial, patient should be assigned like randomly.
Mm-hmm.
So according to this term, what is the randomization? Where is the randomization?
Read here.
Okay, they said straight randomness.
Got it?
Yes, I have to see
Okay.
each and every word. So if we just look at this, that is randomly assigned, then RR, like relative risk, measurement of association, MOA. Okay, now I got it.
Next.
An 80-year-old woman with multiple medical problems is admitted to the hospital for evaluation of the syncope. Her heart rate is found 36 per minute. She was admitted to another hospital recently, then discharged to an acute rehabilitation facility, and then sent to a nursing home. Review of her history shows that the patient is taking high-dose diltiazem, metoprolol, atenolol. Which of the following medication reconciliation interventions is most likely to result in a decrease in adverse drug reaction and healthcare utilization? Hmm, decrease adverse. No, no. Is it option E?
You think it's E?
Thinking like every drug given by the physician, the pharmacist actually verified that, and if they found any abnormality, the pharmacist actually call the physician. So is that the thing which will
Maybe.
decrease in adverse drug reaction in healthcare utilization?
Okay. Let's check.
Well,
You
okay,
think it's E?
you were thinking what?
I was thinking E too. Yeah, it's E, I think. I don't know why they didn't put the answer here, but I think it's E, yeah.
Okay,
Read the answer.
it is based on the literature. Okay.
Yeah, this is ethics, I think. Quality.
Transitions of care between inpatient and outpatient facilities and between units within inpatient facilities are potential source of medical error. In particular, continuity of care for in medications is specifically problematic, and errors can lead to an increased risk of medical application as well as cost. As a result, most patients facilities most patient facilities in the United States have instituted protocols to improve the accuracy of the medication during transition of care. Okay. Objective studies to identify best practice for medications reconciliation have been limited, with a few interventions confirmed to improve the quality of care. However, interventions that target pharmacy personnel and a high-risk patients in particular appear to have the most impact on the quality of patient care. Continuity of care for medications at the time of transitions of care between inpatient outpatient facilities and within Inpatient facilities is a potential source of medical error. Interventions that target pharmacy personnel and high-risk patients appear to be most effective in improving the quality of patient care. Okay.
Next.
A neurologist researching patients with stroke wants to study the association between the cerebrospinal fluid concentration of a tau as an explanatory variables and the brain atrophy measured quantitatively using two outcome variables, ventricular volume and total brain volume, 1 year post-stroke. In a total of 210 with first year, uh, a, a total of 210 with first ever ischemic stroke or transitory ischemic stroke without pre-existing cognitive impairment are included in this study. After 12 months, CSF biomarkers including tau protein levels are assessed. In addition, subjects undergo MRI and the brain atrophy is estimated on calculation of CSF volume and total brain volume normalized for subject head size. Which of the following best statistical technique describe the association between the explanatory and the outcome? Hmm, best. What is the answer?
You tell me.
I'm not finding any clue from where we should get total. Okay, is it fast without pre-existing? There is no disease or a non-disease. Uh, hmm, I don't know the answer.
What are they asking you?
That's the thing I am looking for. What is the best statistical technique to describe analysis? They are working with the patient 210 patient with ischemic stroke or TIA without pre-existing cognitive impairment. Then they see the CSF biomarkers after 12 months and they found something.
Now you're just reading. What are they asking you in your own words? But now you're just reading. What do you think they're asking you?
They are
Okay, then
asking the
since
numbers,
mhm.
mean.
Okay, since you don't know what's the answer, can you delete some answers that you know is for sure not
It
that?
is not ANOVA.
Okay, there's the data. No.
It is not disease versus non-disease odds ratio.
Okay, let's delete those ratio.
It is not relative risk.
Okay, let's delete the
It it may be chi-square or linear regression. It
okay.
is They are categorizing between linear
Okay.
regression. They
What
are
do we remember? Okay, go ahead.
sorry, what do
No, go ahead. You wanted to say something. Sorry, I cut you off. You wanted to say something.
we are categorizing the patient with stroke or TIA based on something.
What
I
is what?
I think it's uh okay. It may be
Okay,
linear regression.
think about you came out with only two answers. And then what do we remember about chi-square? Chi-square was two groups,
Uh
and then we were comparing a category, something that's not a number.
yes,
Remember, t-test was two groups, and we were comparing means, so
means
numbers.
numbers
And chi-square was two groups, and we're comparing something that's not a number.
number
Do we have
like
two groups? Do we have two groups here, and we're comparing something that's not a number?
no.
No. Basically, here they are trying to find what is the association between uh, concentrations of tau in the CSF. So it's a number. Okay, concentration level. So is it 2, 3, 5, 6, whatever? 1 year post stroke. And how does the concentration, the level of tau in the CSF explains the brain atrophy? All of that after 1 year post stroke. So they waited for the patient to have the stroke, and then after 1 year, they measured the tau in the patient CSF, and they also measured the brain atrophy. Okay, and here they are giving you more information. Since you don't know how they're measuring the brain atrophy, they're telling you we are using quantitative. That means number. We're using a number, quantitative outcomes variables like ventricular volume, so 20, 50, whatever, and total
Yes,
brain volume like 50, whatever. So they are using level
number
of tau, which is a number, which is a number, and they are using quantitative. They tell you which is another number. So they are using dumb numbers. I remember we say up there, whatever, I don't remember what was the chart. That when it's too quantitative means number, qualitative means whatever category, whatever quality. So we said that when you were using two numbers, two groups that are numbers, is linear regression. So you did good. You removed all the other ones. It was just you remember the definition of this and the definition of that.
still I'm wrong. Okay. A regression analysis can determine whether CSF concentration of tau is significantly associated with brain atrophy. However, given that the study measures brain atrophy through two different variables, ventricular volume and total brain volume, two different regression models are required. One, one to one to evaluate the association between the CSF concentration of tau and the ventricular volume. One to evaluate between CSF association of tau between the CSF concentration of the tau and the brain volume. Regression analysis may or may not adjust for other variables of interest. Okay.
Okay, can you read the chi-square since you were confused on that one?
Yes. Chi-square evaluates the association between two categorical variables as in a study evaluating the association between the sex, male, female, or myocardial infarction presence or absence.
Got it?
Yes,
Okay.
a regression analysis is a statistical technique used to describe the effect of one or more than one quantitative. So linear regression is too quantitative. variable
Yes.
to quantitative. Okay.
Next. I think that's the
Null,
last one.
yes, null hypothesis. A group of investigators plans to conduct a study to assess the relationship between colon cancer and elevated CRP. The study design involves determining the prevalence of elevated CRP level of colon cancer in a sample of individuals at a given point of time. The prevalence of elevated CRP levels in compared between patients with or without colon cancer. Which of the following is the best statement for the null hypothesis for this study? Okay, colon cancer is more prevalent in students with elevated CRP. No, having a diagnosis of colon cancer does not affect the causes. No, subjects with elevated plasma CRP level are found. No, the risk of colon cancer is same. Subjects with or without plasma. With the CRP, is there any association with the colon cancer? I don't think so. In colon cancer, or do we see the CRP level? I don't think so. So that is the statement. I think that this is that suits for the null hypothesis.
So what? Wait, what do you think is the answer? I don't understand.
E.
E. Okay,
Yes.
let's check. It's E. You're right. Can you read the explanation?
Okay. To state the null hypothesis correctly, the study design must be considered. In this case, the study is cross-sectional as the investigator are taking snapshot of a sample and measuring prevalence of the elevated CRP level and the colon cancer at that time. Therefore, the null hypothesis should state that there is no association between elevated plasma CRP level and the colon cancer. In general, null hypothesis represents a statement of no association between the variables of interest. As this is a cross-sectional study, the temporal relationship between the two variables, whether the exposure preceded the outcome or whether the outcome preceded the exposure, cannot be determined. It would not be suitable for the null hypothesis in this case to suggest a temporally or risk profile, whether having colon cancer is a risk factor impacting CRP level or having elevated CRP is a risk factor for colon cancer. Okay. Okay,
Okay.
last line. The null hypothesis is the statement of no relationship between the exposure and the outcome. To state the null hypothesis correctly, the study design should be considered. Okay.
We have